introduce our president and CEO, Gary Salamito. Gary was named president and CEO of the NC Chamber in 2019. He has decades of experience and a proven track record representing North Carolina business interests at the NC General Assembly. Gary led the Chamber's lobbying and advocacy and political efforts before being named its Chief Operating Officer and acting president in 2018, then president and CEO in 2019. Gary's leadership in advancing policy at the NC Chamber has helped propel the state to the top of a number of best in business rankings. Prior to joining the NC Chamber in 2011, Gary worked 19 years at GlaxoSmithKline, the last 10 years serving as its Director of State Government Affairs. Gary's full bio can be found on our website. Now, Gary, over to you.
Well, thank you, Natasha. It's a pleasure to be here, and thank you all for joining us today on this webinar for our guests and all the folks that have come onto the webinar in this really important time. And with Mental Health Awareness Month, well, we're into it right now and upon us. It's an important and critical time for the business community as we look to come out of the pandemic to have this critical conversation about people. Because our businesses are about people, and people are the priority for the business community and have been and always have been and continue to be that. And particularly at this really critical juncture when the longest tail of a pandemic is what are the mental health implications of coming through a pandemic, and that time tends to last a lot longer than the pandemic itself historically. The effects of isolation, the effects of adversity, of not seeing people, of loss that you've experienced. So our members have been very clear with us as they look to retain talent, as they look to attract talent, as they look to take care of their people as they come back to work. One of the biggest issues and challenges they're facing is how do we provide for the whole body health of our employees? How do we make sure that the physical, emotional, mental, and financial health are all there together so that people can heal and so that they can perform well at their jobs and have a meaningful lives going forward? So we've been listening over the last few months, and it's really important that we have this discussion. The Chamber was listening, and we're going to be launching several components going along with this webinar today. We're going to have a resource kit, a landing page on our webpage. We're also going to be doing 2 webinars. This is the first of those today. The second will be with our members talking about how their culture and how they're working with their management to have that culture go throughout the organization to talk about the challenges that we're facing with mental health and how we help our employees come through it. You know, as Natasha mentioned, before I came to the Chamber, I was with Glaxo Wellcome, then GlaxoSmithKline for 19 years. And we had a portfolio of medicines that were used to help people with mental health. It was through 4 mergers, 3 children, and a number of other things, and learned that the culture of being able to talk about a person's mental health and employees' mental health starts at the top of the organization. And I was very fortunate to work for a leader there and leaders there who made it a priority. And we had medicines that were helping people with mental illness. So we learned how to engage, and we learned the importance of how we talk to each other at every level of the organization. So I personally want to thank you all for being on the webinar. Really excited to have our guests here today. Thank you for your time and for your guidance over the last few months and years to help us get here. So let's go ahead and jump on in. I want to thank our panelists. We have with us today Amel Blanchette, who is U.S. Talent Partner Lead at UCB. Hello, Amel. And
Hello.
We have Erica Ellis Stewart, who's Director of Corporate Social Responsibility at Atrium Health. Erica, it's good to have you with us also, for sure. That being said, I'm eager to hear from our panelists. So why don't we go ahead and jump right in? And, you know, we want to get to know these companies, learn a little bit more about how they were looking at mental health before the pandemic, during the pandemic, and now how coming out of the pandemic, what's the same, what's different. So why don't you, as we go through this, introduce your companies and talk a little bit about each of those pieces, and then we'll jump on to the next piece. But why don't we start with Armel? Tell us a little bit about UCB and your journey before, during, and after, and then we'll go to Erica. So Armel, over to you.
Excellent. Thank you so much, Gary. And I'm very happy to be with you this morning. Absolutely, very, very important topic, very important to reflect, right, after the years we've gone through. So my name is Armelle Blanchet. Today I'm the global HR lead for the rare disease therapeutic area at UCB. I'm based in Atlanta. I've moved here with UCB. Actually, I was very fortunate to move to Atlanta with my family, 2 kids, a husband. And in the past 3 years, I've been leading HR in the US for UCB. So that's the reason why I've been so fortunate to move here in Atlanta. So UCB is a mid-sized biopharmaceutical company, around 8,000 employees worldwide. We operate in around 40 countries, 40 countries. And our commitment is to discover and provide solutions for patients suffering from severe chronic disease. So that's our mission. It's a great mission, and this is in a very nutshell what UCB does. So thank you really for the opportunity to reflect, and that kind of helped me as well to reflect myself about the kind of years we've gone through here, right? So when we think about well-being and the culture in companies, absolutely, I think these 3 years, we've seen such a shift in a lot of elements that really make companies think differently about well-being, right? And I would really summarize that in 3 kind of key elements in my view. The first one that really shifted how we think about well-being was the kind of lines that were totally blurred between our professional and personal life, right? I'm sure you've been in that kind of meeting with your colleagues in a kind of team or Zoom meeting where, you kind of saw at some stage the children or the husband or the wife or whatever of colleague kind of passing by in the living room, right, in the background. So this obviously was pretty new. We haven't necessarily done that, that wasn't necessarily the kind of setup in a corporate world before. So for me, these elements of the blurring between the two, absolutely, that's a key element that made us think differently about well-being. The second element, I would think, is definitely the social, economical, and political issues that kind of were pretty separate in the past, right? That wasn't necessarily topics that we would discuss in the workplace. And you saw in the past year these topics, slowly kind of getting their way, right, in the workplace. And as a company, I think it's important that we understand that, and having the ability to facilitate these type of discussions. During the time of social unrest, it was very important for colleagues to express how they were feeling, right? So for me, these elements, grasping the importance of people talking about it, absolutely very important. And the third element, I would say, is what we realized pretty quickly during the pandemic was that every situation is different, right? You cannot compare the situation of a working parent, I was one of them, struggling with the homework, really needing help to help their kids, or people single who were extremely isolated. So I think, again, as companies, realizing every situation is different, and as a consequence, every solution, could be very different. So 3 elements for me that really made us rethink as a company how we apprehend, and how we help our colleagues and their well-being. As far, and Gary, let me know if I continue or not, but I was just going to say that the business case is right, pretty straightforward. I've been in HR for a long time. Partly as well in GSK, quite a long time as well, Gary, in my career. The type of questions I get from candidates is pretty different, I think, when I started my career and what I get now. Absolutely. Candidates want to know what we're doing from a well-being point of view. What are we doing from a health point of view? What are we doing from a D&I point of view? These questions, they are, top of mind for our candidates. This is quite different from when I started my career. So as companies, you need to have very strong value propositions on all these areas if you want to really retain, attract the best candidates. So yeah, absolutely, there's been a change there on how, as companies, we are able to attract candidates. And the last point I would say is retention. Yeah, pretty change as well. Obviously, beyond the kind of competitive salary, all that kind of thing. You hear more and more employees talking about, well-being. How do I recharge my batteries? What's your policy on time off? How do you ensure people, are, recharged from a mental and physical well-being as well, right? So time off is definitely a topic. And no surprise, I'm sure you've read a lot of articles around that, flexibility in the workplace as well come top in mind for people to want to stay in companies. And a lot of people would say, I'm so sorry, I would not stay in your company if if that's the traditional 9 to 5 model, and so, I'll look somewhere else. Very, very clear. So yeah, so for me, that was definitely the key elements that shifted and got absolutely accelerated in how we think about well-being companies.
Thank you, Armel. I appreciate that perspective. Really helpful. Erica, you're with a healthcare system, so you have two perspectives. You have the perspective of an employer that employed a lot of folks, and also one that has health professionals that have been taking care of a lot of folks, and that were under heavy pressure before the pandemic, but then did heroic work over the last 2.5 years to take care of all of us that aren't directly involved in healthcare. So tell us a little bit about Atrium and how you looked at it before, how you took care of your employees and your patients, and then what changed and what you're facing now. Glad to have you with us.
Awesome. And thank you for having me, Gary. Just a little bit about me. I'm fairly new to Atrium Health. I came in January of this year. And so I've been here about 4 months, but I come in with a backdrop around mental health education, behavioral health, advocacy, and policy. And so that really informs my perspective coming into Atrium. A little bit about Atrium. We are one of the largest employers in this region. We have over 73,000 teammates in our entire footprint. And in the greater Charlotte community, which is 10 counties, a portion of those in North Carolina, a portion of those in South Carolina, we've got about 42,000 teammates that we're serving. So we do have a very interesting dichotomy in terms of our staff. About 4,000 of our teammates are doctors and physicians, roughly 19,000 are nurses, and 40 hospitals across our footprint. So there are a lot of different types of workers in our team. So everything from direct service to administrative to support services. And as Amel said, each individual needs a different type of support depending on their situation, but you also have to tailor that within what is the work type, right? Are these hourly employees? Are they salaried employees? Because you may have to do different things. One of the things that I think Atrium Health has done very well is when you look at the benefits package. The benefits package is inclusive of mental health services, mental health therapy, but we also have a very robust EAP, which is an employee assistance program. We have put in place a 24-hour crisis line that teammates can call if they are personally experiencing a trauma, if they have experienced something on the job. And we all know the last 2 years with COVID is definitely experiencing something on the job. I would say that, it's also been interesting for us because a good portion of our teammates are on the front line. They're coming into a medical setting, a healthcare setting day in and day out. Before vaccines were available widely, daily as the numbers went up, as the numbers went down. And so you really do have to make sure you're caring for their physical well-being, but you also have to make sure you're caring for their emotional well-being. And so in addition to the EAP and the crisis line, Atrium Health has done some amazing things. We have what's called the Compassion Champions, which is a group of people who voluntarily figure out how can we come in and really connect people to hope, reconnect them to hope, reconnect them to joy, notice when people are struggling, give them that pat of love and support, which is incredibly important. We also do things like Code Lavender. If you just think about lavender, what it is on its own, if you smell essential oils or lavender, that's all about bringing you to a place of calm and peace. And so the name is really indicative of what happens through that program. Some of the significant things dealing with the blurring of lines, people going from in office to working from home, people being on call day after day, all of these things are important in terms of how they impact the mental health. And I think just as Amel said, the business imperative is really key. When you think about mental health in the workplace, it's really not a buzzword. It's really not the flavor of the day, but it's something that has to be integral to your work. If you want to retain people, if you want people to work to their highest self. When you think about the why as an employer, 1 in 5 Americans will deal with a diagnosable mental health concern at any given year. That's over 46 million people in the US. Just do the math in your own company. When you look at depression and anxiety from a global perspective, these are 2 of the leading production loss categories when you look at chronic health. And overall, just in the US, anxiety and depression cost about $1 trillion in loss each year. So these 2 things, if you don't pay attention, there's definitely a dollars and cents piece of it. But this is also about creating the culture that your employees want to be a part of. And we can talk more about some of the things you need to do.
Well, thank you, Erica. And Erica and Armel, you both mentioned that people are looking at the world differently because of the experiences that they've had. One of the things we do know that is helpful as we look at this together is we do have shared experience now that perhaps we didn't have before across all kinds of different backgrounds and diversity issues that were challenging before. But now we have a common framework to begin to have discussions in a way we haven't before. We have a reset going on. Some people call it a retrenching. I think it's a reset of people and our talent. Healthcare folks that have done great work that say, I don't know if I want to go back to healthcare anymore. And some of those are retiring. But then we have young people saying, well, I want to go into healthcare now because I want to help people. And then everything in between. Folks, do I want to travel as much? We're hearing from executives that, boy, it was really nice to be home at dinner. And that I was able to get the work done and I didn't have to be on a plane 80% of the time. And so I'm going to reset that perspective too. And we're also hearing that the HR human function, while always important to organizations, is now moving into a C-suite discussion. That it was, part of the organizational development, but now it's a C-suite priority. People are talking about how we help people and how we retain them. Talk a little bit, and we'll start with you, Erica, and then go to Armel, a little bit about your interaction with your C-suite executives and how you've encouraged them. And you both work for very progressive organizations that have great leadership. Talk about that leadership and how they encouraged that in the C-suite level to become a priority for your organization, because as you both know, that's where it starts, and then it goes from there. So how is the C-suite? What kind of discussions did you have that got the C-suite to a good place?
Well, as I mentioned before, Gary, I'm fairly new to Atrium Health, and so I'm coming into a lot of work that has already been done. One thing that I'll point to is just really the work around culture within Atrium Health. That is a language that we talk about all the time. We talk about our culture commitments, and we try to practice those. And so when you look at our culture commitments, it's about creating a space where we all belong. It's about working as one team to make great things happen. It's about earn trust in all that we do. It's about innovate for the better, the now, and to create the future. And then last but not least, it's about how we drive for excellence always. And so we're setting forward, here are the expectations of our culture and how we'll treat each other and how we'll engage from one another. And that is definitely coming down from our C-suite, from our CEO, from our leaders. But it's not just words on paper. It goes into how do we get feedback from our employees. And so Atrium does a great job of seeking feedback via survey multiple times a year on people's experiences. I know as a new teammate, I received onboarding surveys about that process. Employees have annual anniversary surveys. And so we are constantly looking for data to find out about what our employees are feeling, what their concerns are. And we have a process of rounding and conversations and huddles to make sure that leaders have an opportunity to connect with their teammates and to really, flesh through any trends that we see that affect the entire organization, or even just one-off situations. Because at the end of the day, employees want to be heard, they want to be seen, and they want to be supported. And so as we talk about our culture commitments, that's one example of where it starts. When you look at the pandemic itself, again, we are in the business of caring for others. We can't care for others if we don't care for ourselves. So our teammates are often our patients as well. So when we look at innovations that we were able to do during the pandemic, such as increasing access to telehealth, mental health service, as well as physical health services. And I know, Gary, you and your organization have been extremely vocal and supportive of that. And we want to thank you for that as well. But allowing telehealth services was a game changer, not only for those within our organization who needed mental health or other physical health services, but also to community members, because it allowed us to continue serving people in ways that we were not able to do before. So.
Thank you, Erica. Yeah, it's very important that, I mean, we all have personal stories about things we learned. And if your organization doesn't have the support of your executives, it's difficult. So thank you for your leadership there. We all learned from it. Armel, UCB is a global organization. You have teams operating in different countries that are coming together with very different experiences. Talk about how your executives came together and how that worked for UCB.
Absolutely, thank you. And I love your examples, Erica. It's great. I'm learning a lot. Absolutely. So, at C-suite level, I think it's taken extremely seriously, right? And there has been a shift in the past year. So there is something we call sustainability. And sustainability, tackles topics like the health of the planet, like D&I, like well-being is one of the elements that, is there. And in the past year, it's progressively being totally embedded in our strategy, right? So at a leadership level, this is, part of what people have to deliver. People are measured against it. So it's absolutely now embedded in our strategy. And so for me, that was a big shift. We report on that. There has been a big shift in how we've kind of evolved as well our strategy in the company. For me, leadership is really about two things, right? It's creating the right environment as a first kind of step. So it's very interesting, right? So creating the right environment, and I will give you examples, but the compass we had throughout these 3 years was always, people care, right? So with that in mind, there was a lot of thoughts about, how do we create the environment? If I go back to my example there on, all the challenges that we faced, and that we are still facing in the world, from climate change to rising inequalities, etc. These are totally linked now, and the business has a key role to play, right, in this topic. So for me, recognizing that as a C-suite, as leadership, is already a big step. And if I go back to that example again, when we had social unrest, etc., as leaders, we recognized again, the need to have, employee resource groups. So we created 7 different employee resource groups, recently, because we knew people, felt that they have to kind of have this type of conversation and share how they were feeling at the time. And I think it was it was a great experience, because that was very grassrooted, so very organic. So people came together, proposed, and we created that environment, and very inclusive as well, right? So they were really inviting all people in the company to have courageous conversations, safe space, etc. So that was very interesting how, as a leadership, I think you have an accountability to create that right environment, but also leave space, right, to have all these groups organically kind of forming and coming together. So great experience for me, learning as well. And I said there were 2 areas. So I think the second one as leader is just do it, right? Act, role modeling. Absolutely, you need to do that. So again, going back to the employee resource group, each senior leader is a sponsor of an employee resource group. So just taking my example, I'm sponsoring the RAIS employee resource group, which is the Latinx Hispanic employee resource group. I just loved it. So it's for me, that was definitely a great way. We did education sessions on the history of Cuba. That was the theme at the time. I learned so much about the history. And I think as leaders, when you really take off your corporate hat and put yourself in the shoes of the colleagues, that's the best way to really understand where they're coming from. And that's for me the first step of an inclusive culture. So, putting yourself in the shoes of others, what a great way to really kick off an inclusive culture.
Thank you, Ramel. Yes, if we first listen to understand, not to respond, our teammates, our friends, our family, our coworkers will tell us how we can best solve some of those problems. And one interesting piece is about how the workforce is forever changed because of the pandemic. The expectations, the needs, the way that people want to work and integrate their life and their work together, everything's changed. The availability of childcare is different than it was before and after. People have come in and out of the workforce. Fewer women are coming back into the workforce now than men after the pandemic. There's a number there. So there's a group of folks, a very diverse group of folks who are looking at the world differently. I think we could start with Armel and then go to Erica. What are some of the things that happened during the pandemic that you didn't expect? And what are some of the things that you say, oh, wow, I didn't see that one coming? As we go, because going into the pandemic, economy was good, people were rocked, things were generally good. We had our challenges, clearly things we had to work on. And then one day we're sheltering in place for 18 months. And all of a sudden things have shifted from how we educate our young people to availability of daycare to multiple generations living in a house together during this time, to caregiving not only for your children, caregiving for your parents, which I had to do some in our home. So talk a little bit about things that were unexpected, a little bit about what are some key learnings coming from that are going to fundamentally change the workplace. So why don't we start with Armel and then we'll go to Eric.
Yes, so I don't think there was one thing I expected. I'm trying to digest what happened. So big learning, expect the unexpected, right? And when it comes, just embrace it and engage with everyone around you, co-create and try to do as best as you can. So I would say everything was unexpected. A few learnings, obviously, kind of, the not one size fits all approach, as I said, and I think what we've tried to do is really, like in a restaurant, right? Try to provide a menu to our employees where they could pick up from, because as you just said, it was so different, right? The situations were so different from one colleague to the other. So just as examples of things we did, time off. I mean, people were connected 24 hours. That was so tough, right? So what we decided, just as examples, recharge days where no connection that day because everyone's off. We got such great feedback there, which is, makes you think a little bit about how difficult it is for people not to connect all the time, 24 hours. So when you talk about mental well-being, that plays a big role. So recharge days was an example. The Friday afternoon free meetings we did, again, that was great feedback because, again, people need to disconnect, do a bit of different activities and just staring at a screen 24 hours. So these are examples on top of, we did a lot of classical kind of well-being seminar, yoga classes, virtual, Peloton. We kind of offer a program, great feedback, by the way, to all our employees so they could do, they have this monthly package. So for me, it's really like there was a menu I think people could pick up, and that's where you got great feedback on all the offerings we had. And they could really choose whatever was suiting their most. I think if I continue a bit on so still learning, right? We still learning, I think. So hybrid model, right? Big topic. I think companies are obviously still questioning, what's the best way here. We're still learning every day. I think the approach at UCB was definitely to again, co-creation with the colleagues, right? What works best? Again, we know it's different, right? We know people want to be able potentially sometimes when your job allows it, right? If you're not necessarily working in all day long in a manufacturing site or in a laboratory, but people want to be able to have that flexibility, right? To be able to go to the doctor potentially with their children. So I think this flexibility, that's really where our intention is. So we don't have set days on our hybrid model. We have a 40%, 60%, so 40% kind of monthly average on when you have to be in the office or face-to-face, and 60% when you work from home or whatever you want, but not in the office. And that works quite well, right? We don't have set days. Again, people basically the nature of what you do of your work determines the location. Are you more efficient because you have focus work to do at home? Great, you can do that at home because people feel so much engaged or more efficient if they're able to do that, where they choose to do it. If you have more of a collaborative brainstorming kind of workshop, yeah, absolutely, that's much more efficient, right? When you're face to face with your colleagues, you deliver so much more there. So again, no set days. This is really discussion between the teams and the managers and what's the best, what's the most effective way to do the work that you have to do. So that's still absolutely we're on a learning curve there. So that's just examples, but I would definitely say I would expect now the unexpected after the 3 years we've been through, and embrace it, and really co-create with the colleagues.
Thank you, Armel. Erica, from your experience, what did you expect? What didn't you expect? And what thoughts and advice do you have for us?
Yeah, I agree with Amel. It's, expect the unexpected. I think none of us could have considered the length of time that we've all been impacted. I don't think we could have anticipated the extent to which we would all have a new normal, if you will. The extent to which our lives are really forever changed by this experience of COVID. But when I look at this through the lens of my current work, it's also the need for deeper and greater social impact, because what we see with COVID is that it's not just impacting us as individuals or families, but it really is impacting neighborhoods and communities and entire states. And so, it really pushes us to see that need. And as an organization, Atrium Health, to really think about how can we have greater social impact. And so we have really looked at how can we move, the investments we make in the community to nonprofits and to community groups and to issues beyond transactional to transformational, right? Because we see increase with food security issues. We see increase around so many things that if we can deploy the time and talent of our teammates, we can be a part of the solution, which I think is incredibly important. During the pandemic, last year alone, Atrium Health teammates provided over 30,000 hours of volunteer service to the communities that we serve. And that's important. That's important to individuals to feel like they can give back and make a difference individually. But collectively as an organization, that says to our community, we care, we see these issues, and we want to go deep with you to solve. In addition to those hours of service, we've really looked at how do we codify that within the organization with our teammate volunteerism policy, where it says we will give teammates a certain amount of time during their work day or during their work week to go out and provide service to the community. And that service is twofold. It's filling a community void and a need, but also when you think about service and what it does to us and as individuals and how it impacts our brain, when we can be of service to someone else, that gives us a sense of purpose. That gives us a sense of engagement. That gives us a sense of pride in the organization. And that also serves as a retention tool, because people are looking to see, does my organization care about the things that I care about as an individual? I also think when you think about this new normal that none of us could have really anticipated, Atrium has done a phenomenal job in terms of really helping people to identify how they can be resilient, because you really need resilience to continue to go through this experience called COVID, if you will. But we've also provided people with resources. And so we have kind of an on-demand learning lab, if you will, where people can go and get videos or little lunch and learns, midday mindfulness, a lot of wellness workshops and webinars to be able to provide extra. Even though we're working from home, you've got teammates who are on Teams or on Zoom teaching a yoga class or a Zumba class just to create that connectivity. But also when we think about our own mental health, we know that movement is a big part of that. And so even using technology to help people connect and get beyond feeling isolated, but also to have opportunities to move their body, which is incredibly important. And so I think, making sure as an organization we can help people increase their level of resiliency, but also give them tools that they can utilize whenever they need it or whenever they desire is incredibly important. And that's one of the things that Atrium really focused on during this time.
Thank you, Erica. Very helpful. Please excuse me. The allergies are getting to me now, so I got a little tickle in my throat. So I apologize to the panelists and all the participants if I was coughing a little bit.
Oh no, we didn't hear it.
You didn't hear anything? Okay, good. Thank you. We've talked a lot about, and both of you have given some incredible examples of ways and how companies and people can begin to get engaged. Small to medium-sized companies don't have the resources that a Glaxo would have or some of the other companies would have. So when you think about the people you're serving in your communities and how you're helping your employees, and Erica, for you, how you're helping small to medium-sized businesses in the communities, what are some specific things that you think they could do? They don't have the benefit of having Erica Ellis Stewart with them, but they have great people in their community who can help, who can do some things. So we'll start with Erica and then Armel. What advice and counsel and specific ideas would you have for some of those smaller and medium-sized companies and how they can engage?
Yeah, I mean, so a part of building a culture that's friendly to mental health, I mean, you can have policies, programs, and practices, but those things are only as good as the people. So the leaders, the supervisors, the coworkers, and other teammates. And so, one of the things I think is important when you're in grade school, your teacher told you AEIOU. Remember that in school? It's like, drummed into your brain. When I think about AEIOU, from a teammate or a culture of mental health, it's A is acceptance and awareness. E is educate folks on mental health, what it looks like when someone's dealing with a mental health concern or crisis, what it looks like when someone's considering suicide. So the I is involvement, instinct, the ability to intuit. The O is the ability to observe, right? Observe what you're seeing and then offer help and support. And then lastly, the U is about understanding, urging a person to seek help and encouraging them to use and utilize the resources. And so, every organization, whether it's a small organization, a medium or large, can really pick up on this concept of AEIOU. Beyond that, Atrium Health can be a phenomenal partner because, not only do we have, hospitals and ambulatory centers and physicians, but we have a wonderful resource right here in the community through our employer services division. And the employer services division can work with small, medium, large size companies to help them craft an EAP, an employee assistance program for their teammates. We can also help with putting together mental health services within the organization. But more importantly, back to that piece of education, acceptance, and awareness, we can come along and be a thought partner and a trainer to provide mental health first aid, which helps lay individuals know what does it look like when someone's dealing with depression or anxiety. And then what do I do? I can't just stand there and look at them wide-eyed. What do I actually do when someone's experiencing that? So our employee solutions can come alongside and do many of those things as a partner with companies, because it's difficult when you're dealing with mental health individually for folks within the organization, or when they're coming to work because someone in their home is impacted. And you have to have a response, and that response needs to be one that doesn't increase the stigma that's often surrounding it, but one that is breaking down the stigma and really giving people support, resources, and really just a place that they feel like, okay, I'm going through a struggle, but my workplace isn't just going to boot me out of the door because of that.
Really helpful. Thank you. And yeah, we all have to remember we have physicians and we have healthcare providers that are there to take care of us, and systems, and to check in with them, and they can help guide us. Thank you, Rick, very much. Armel, any thoughts for our small to medium-sized companies that perhaps are good members of the UCB team that don't have the resources that others do? what would you think? What would you suggest to them?
Yeah, absolutely. And helping communities. Huh? So I think I like what Erica was saying about, when people help others, right, you always feel a bit bigger than yourself, right? So you feel so much more engaged. So I think at UCB, what we're doing, from a community perspective. So, and that was, by the way, also one of the compass, right, during the pandemic about helping our communities. And we did quite a lot around that. So one of the examples I would just highlight here. So we have a number of volunteering hours as well for employees. So there was a lot of people who kind of used them, right, during the pandemic just to help the community around them. So whether it was to kind of bring lunch to some community during these volunteering hours, helping charity. A lot of activities took place, and people obviously, are very keen to use these volunteering hours. So I think, companies like UCB, absolutely, we have, our employees are the ones, who could definitely play a big role in helping communities. The other example I would highlight here, so obviously we're a pharmaceutical company delivering, medicines to patients, right? What we kind of recently evolved to, and again, that was, with the support of the employee resource group. So I'm going to give an example here. The employee resource group obviously can help to facilitate access for some communities that don't necessarily have access to our medicine, right? So the RAIS, again, Latinx Hispanic Employee Resource Group is worked on a phenomenal project, right, to help patients, from the Hispanic community to access our products in epilepsy. So this is phenomenal because they're, really, they know really well the community, and they can really help us as a company to help some communities access to some products that they would not necessarily have access. So I think these are just examples, working through our colleagues. Our colleagues are really very eager to help the communities around us. They're absolutely instrumental on helping us to help the communities that are so close to us, right? So that's the two examples I was thinking about, really, as a company, that really highlighted what we did and what we're still doing for our communities around us.
Thank you, Armel. It's one relationship at a time, right? Person to person, taking the time to listen and help each other in our communities at the end of the day. Thank you both. We're right at the end of that part, and we have some time for questions and answers now, but wanted to make sure, Armel, Erica, thank you for the insights you provided today as we do our part as a business community to help our members at the NC Chamber, and also help their employees through this time as we get ready to come back into, I don't know what normal looks like. It's going to be different, but we have to provide resources for people to sort through that. So thank you both. Been very, very helpful today. Much appreciated. So Natasha, we're open for Q&A now. So let's go ahead and see if any of the members and any of the folks that are on the webinar have some questions for our panelists.
Absolutely. Erica, it looks like you are answering this, but it's from Macy Benjamin. Can you share what AEIOU stands for? She wants to write a little bit more in her notes.
Sure. So you got an Erica Ellis Stewart original, right from the brain of Erica. So AEIOU. So the A is for acceptance and awareness. And so oftentimes we do not want to accept when people are dealing with a mental health challenge. And so we often leave them kind of stranded and hanging. The other A is awareness. Just, do we know what it looks like? Do we know how we can be helpful? The E is for education. Within our organizations, are we providing opportunities for teammates and supervisors to learn what, mental health education, suicide prevention education, even simple things like active listening. Do we have classes for people to learn active listening, which is a huge part? The I is for involvement. Are we willing to involve ourselves? You see someone that's hurting and challenging, you're just like, that's not my business, I'm going to walk on. So are we willing to get involved? Do we use our instinct, right? This person needs help, and I'm going to lean in to be their support. The O stands for observe. Do we have the skills to observe that someone is struggling? But more than observing, do we have the willingness to offer help and support? And then lastly, the U is for understanding, understanding what they're going through without judgment, urging them to seek help. And you may have a variety of resources within your organization, your HR department, an EAP, local behavioral health programs. And then are you encouraging them to use or utilize any tools? So I mentioned before, Atrium has compassion champions, we have Code Lavender, we have resources, the resilience resources, and many other things. So it's just a way to remind us that we have to see people and we have to support them. So AEIOU. And I'll try to type that in the chat in just a moment.
Awesome. What's been the response from employees on the additional resources and focus on mental health?
So that's a really good question. And I was talking to some of our behavioral health folks just yesterday about what the increase of usage has been. And I'm actually, see if I can put my hands on that specifically. We've seen a very large increase. So in 2008, for example, we had just over 6,200 EAP use visits, kind of that initial inquiry. And up to 2001, we were at over 8,300. And so people are definitely using the service. But back to that AEIOU, you have to make sure people know that it's there. They know what it is. They know that it's confidential, that, you know, it's in places where if they don't want to talk to someone about it, they can readily see the information, right? A bulletin board, back of a restroom door, you know, they don't feel like, oh, I have to go, you know, kind of stalking for it. We make it easy as well to get the information, but we've definitely seen an increase. One thing that I would just say for most organizations, you look at the data from SHRM, the Society of Human Resources Management, they have often said for a lot of organizations, the usage of EAP is below 4%. And EAP is a huge benefit. I know with Atrium Health, we increased the number of usage that you can have. So, and it's per incident. People right now can have up to 6 visits with an EAP counselor, therapist, or practitioner. But in the pandemic, we actually took a cap off of it and they could use it unlimited. And so just looking at how you use benefits like this, but making sure people are aware of it, how to access it, and that we remove the stigma of using it, I think is incredibly important, because you want to get from 4% to, you know, whatever people really need.
Thank you, Erica. Armel?
Yeah.
Or Gary, excuse me.
Oh, no, Armel, please. And then I was just going to say, even for small organizations like ours, we discovered through one of our insurers that we had access to a free EAP program. So you may even have a benefit through an existing insurance product that you have that you're unaware of. And we were able to put that out and say, you know, here's a good opportunity. So it's not just for larger businesses. It's embedded in things that you may not even know it's there.
Absolutely. And we definitely use it at UCB. So it's the usage has definitely kind of increased. So if I go back to your question, right, what was the kind of response and engagement of people? So we do quite regular kind of pulse checks in the organization. So we know if we're doing things right or not right, actually, quite quickly. I would say, obviously the pandemic provided we went through very, very tough times, but I think, it really forced us to rethink a little bit about the people care aspect, right, of companies and how we really manage that and apprehend that. I would say feedback was really good on, I think, as I kind of mentioned, right, the fact we really tailored the approach. We really left space, I think, for people to come up with their own solution, basically, right? So tutoring programs, we even had some employees coming together proposing tutoring to kids who were at home. So that was kind of coming spontaneously, but I think what people really appreciated was the variety of options available. And what we had as feedback was how much people care, what was at the front and of whatever we were doing. So just to give you an example, we do both surveys on a regular basis. the engagement scores we had, I think that was at the peak of the pandemic, and we measure, as you can know in a lot of companies, what we call the engagement score, right? And I think we had the highest ever. We had 85% engagement score, which for companies is a very, very good score. So we were quite proud of that, and a lot of what we offered, how we really took care of our people during the pandemic, I'm sure is reflected in this number. So yeah, I think overall the feedback was really, really enthusiastic, I think, on all the kind of offerings we had at UCB.
Thank you. What do your company's volunteer policies look like? How many volunteer hours do you allow your employees to use weekly, monthly, or yearly?
So at Atrium, our policy says that managers will encourage a minimum of 6 hours of volunteerism and hopefully more than the 6 hours. One of the things that we do is we have what's called Atrium Health Serves, which is our greater program around volunteer engagement of our teammates. And so we are on a regular basis looking for projects where individuals can get involved individually with their families or with their other teammates as a group. So for example, last month was National Volunteer Month. We had, I think, over 300 hours of service generated specifically to food service. Our teammates ended up packing 60,000 pounds of food for folks in need in our community. So, we make it easy for individuals to get involved by saying, here's a menu of opportunities to serve. And as an organization, we're also looking specifically, or what are some areas where we want to have social impact? So we know food security is one of them. We know that affordable housing, employment, access to care, because all of these things can be barriers to thriving in healthy communities. And so we say a minimum of 6 hours, and then we have a process and a mechanism for people to get involved.
Thank you.
Mm-hmm. So at UCB, we have a similar policy, I would say 32 hours yearly. So people, again, very flexible, they're free to kind of use it as as they like, really. And that can be kind of an individual use. So you can, volunteer individually or as a team, right? So we do team buildings, which are great team buildings, actually. Working for charity in HR, we did, when I arrived, we did a team building, just building furniture, actually, for, communities in need. So, these are great buildings, and we work with a lot of organizations. So we work regularly with Red Cross, Urban Ministries, Ronald McDonald House, and Habitat for Humanity. So we have a kind of charities we work with on a regular basis. But again, it's very easy to use the volunteering hours. It's very well used. And it's as either used as an individual individually, or as a team. We do quite a lot of team buildings as well with these charities.
Thank you. All right, Erica, do you mind repeating what the U is in AEIOU, please? I think we might send this out. So many questions about it.
Understanding, urge, use, utilize. And I'm typing it in the chat right now. So if it's like I'm not paying attention, I'm just trying to type it and spell everything correctly.
Thank you so much.
You're welcome.
Any other questions from our audience today? All right, not seeing any. Thank you all so much. Any final thoughts from you or Gary before I close this out?
Maybe I can start. Final thoughts. I think, obviously, I think we're quite proud of, unfortunately, we had to go through very, very difficult times. Can you hear me? Sorry, I wasn't sure. Oh yeah, sorry. So pandemic, it's very, very tough times that we had to all go through, unfortunately, but I think something, very positive kind of came out of that, right? It's made us stop, reflect, and really think about how we were managing well-being. And as you said, the importance of taking care of our colleagues was paramount. So definitely a big learning there. And we're very proud, I think, at UCB about all the responses we've been able to kind of provide to our people. I think it's great, right? It's a new step. We will absolutely continue. As I said, sustainability is part of our DNA now, right? It's part of our strategy. So we measure, we're going to continue measure how we're doing on well-being, among other things as well. And we know this is going to be what is going to make us successful as a business in the future.
I would say for me, it is about being very intentional about building the culture. So asking your employees what they need, what they're struggling with, so you get a baseline of, kind of where people are, because you can build a solution, but it may not be the right solution. So, whether it's surveys, whether it's conversations, one-on-one and in small groups, and then begin to look at what are the resources you already have in place that maybe you are not communicating broadly about, so people know that they're available. How many times has someone said to you, oh, I didn't know we had that, or I didn't know I could use that. Doing that is important, but more than anything, just, normalizing the conversation. I can't tell you how many conversations I've had in the last 3 weeks with someone about their mental health. And they were surprised because I was so willing to listen, but also being vulnerable. I tell people all the time, I'm someone with lived experience. I live with my own mental health diagnosis. And so when we normalize the conversation, we make it okay for people to ask questions, to seek help, that they don't have to hide that part of themselves. And at the end of the day, they're not able to work as efficiently and as to a level of productivity that they could. And so how we can normalize the conversation, I think, is important. And as I said before, Atrium can be an amazing partner in that through our Employer Solutions program to help small, medium companies to really build that out for their organization and their teammates.
Armel and Erica, thank you for being and spending time with us and giving us some insight. And the only thing that perhaps I would add is that we all need to have more courage. We've been tested and we have a lot of shared experiences over the last 2 years or so. And having the courage to have discussions like this is really important. The first one's the hardest one. But once you have the courage to engage, you help not only yourself, you help a lot of other people as we go along. So thank you both for what you do every day and to take care of your folks and others, and for sharing those insights with the broader business community today. It's much appreciated.
Well, thank you for having us. And Gary, you and your team are really doing yeoman's work, because the offering that you have this month, May is Mental Health Month, is really going to help our companies and businesses move the needle on this. So thank you.
Absolutely. Thank you so much for facilitating this conversation. Again, I think it makes us reflect and think and learn. So thank you so much for that.
Thank you to our speakers today, and for all of you for attending today's today's mental health webinar from the MC Chamber. We hope you found today's content valuable. On your screen, you'll see a list of upcoming events, and we really hope to see you at a future NC Chamber one. After today's webinar, we'll send you a brief survey in the recap email. We would really appreciate any feedback you can provide for us to allow us to continue to improve these sessions. And you'll also receive the recording and the recap email as well. It'll be made available to you within 24 hours. Thank you again for attending this webinar, and please stay safe and healthy during this time.